Aso morning, and now we're beginning the first interview segment. Of course, everybody's aware that the health sector of the country needs a lot of reform. 66% of the health sector, hospitals, clinics, primary health care centers, are solely owned by the government. How functional is that? How effective is that? Are we getting the best kind of cares that Nigerians need? Are we getting the medical facility? Is it expensive? So many questions around the health sector. But the most important question is, what are the opportunities for reform with the new administration in the country? And discussing this with us this morning on the program is Mr. Victor Ezenwa Emejuiwe. I had to do that so I can remember. He's a good, he's a program manager, Good Governance Center for Social Justice. Right. Many thanks for being on the program.
Well, thank you. It's a pleasure being here in your studio once again.
You're not a medical doctor. You're not a pharmacist, but you're interested in the health sector.
Yes, because health is critical to human survival. It's critical to the development of the nation as a whole. And so everybody should have interest, be you a medical doctor or not. You should be interested in the health sector. Yeah.
What should we do? What are we not doing right? Because let's start with the most recent month, 2 months ago. We have seen for the past couple of years, the past 3, 4, 5 years especially, an outflux of doctors, medical personnel, doctors, nurses, anybody that can get the opportunity to leave the country are leaving. We're seeing if the doctors are not striking in one state, they're striking in another state, they're clamoring for better wages. We've seen where Nigerians complain that they don't get the kind of medical services that they require, especially in government-owned hospitals. And then when people can afford government-owned hospitals, they end up going to private clinics, and then they have ridiculous exorbitant prices that they can't afford. So it is obvious, or it is something to say that there's a dire need for a reform in the health sector. How should we start tackling this huge demand?
Okay, first and foremost, I must say the president has a very big tax on his hand now. And I don't want to expect any minister that will come up for health to take a relaxation seat. The health sector is quite in their need of an emergency. We have current ratio to doctor to patient ratio in Nigeria, about 24,000 doctors, serving the whole country. That is very, very poor. The last 5 years had seen 5,000 persons left the shores of Nigeria. Just in the last 5 years, 5,000 doctors left the shores of Nigeria, and we are left with 24,000. So there is need to engage in massive recruitment, massive reforms in the health sector to ensure that our doctors stay back. Whatever that is making them to leave the shores of this nation, the federal government needs to nip that on the bud. We are not in support of the bill that was introduced that banned the immigration of doctors, making them to work for 5 years before they can that's travel. Against the human rights of any citizen. You have the right to your freedom, you have the right to freedom to movement, and as a citizen, you can make a choice where you want to stay. But there are rights incentives that the federal government is expected to put that will make anyone working in any of the sector to stay back. And so for the health sector, critical attention needs to be paid to that sector to ensure that whatever is making the medical doctors to leave, needs to be nipped in the bud. One of the issues they've complained about is the welfare.
That's what I wanted to say. There are two major issues that any medical doctor will be complaining about. One, their enumeration of their wages. They don't get, they're not paid. For someone or for people who deal with saving lives, it should be a priority. Their enumerations are terrible. They're complaining. Second will be the working conditions. Go to most, I say it with all sadness that when you go to quite a number of government hospitals in Nigeria, the stench alone coming out from that place, maybe you pass near the restroom areas or, you know, just even the hospital, the general ambience, it's dirty, people with lackadaisical attitude. So it doesn't even give you that work ethic professionalism that you need to see in a workplace. So those are the two major things I can think of the top of my head. Let's start with how can we address their funding?
So when you look at the health infrastructure, a lot of attention needs to be paid to that sector. For instance, we have the issue of even inefficiency and the effectiveness of management of the little resources that goes to the Ministry of Health. That also needs to be looked at. The Ministry of Health is one ministry that does not even utilize almost more than 60% of its budget, despite the paucity of funds to that sector. And we also discover that they have this dual consideration for projects where the donor agencies are funding one particular project and the ministry is also putting its budget for that same project. For instance, supply of drugs. You go to the storehouse of the headquarters of the Ministry of Health, you see a lot of drugs that are piled up there, almost getting expired. They are not sent to the states and the various zones where they need them. And so Nigerians are forced to pay out of their pockets. So there is a need for government to prioritize what are the infrastructural deficits in a particular zone or in a particular part of the country that needs to be given attention. If we have, like, say, in Abia State, we don't have a state-of-the-art hospital there that can take care of tertiary health care. You know, you prioritize, okay, let's have one in the southeast, set up in Abia or maybe Imo State.
So you have them in
then you
zones.
just have them in several zones. If you achieve that in 1 year, you move to the next stage, you know. So we need to think of a careful and deliberate effort to address those infrastructural deficits, you know, that makes the health conditions or the working conditions of the health workers to be unpalatable. And the overcrowding of people in major tertiary and general secondary hospitals needs also attention. If we make careful attempts to upgrade the primary health care,
people don't have to migrate.
People don't need to go there.
Urban centers
If you choose to visit any of the hospitals now, the general hospitals, you will spend virtually
the whole day.
The most productive days of
the whole day,
you know,
because I found out I can never for the life of me understand it. You go to the hospital, they say no, they don't do this test on Monday. You have to come back on Thursday.
Yes.
You can't do this test on Friday. They have to come back.
Exactly.
I mean, for the life of me, I cannot understand
exactly.
it.
And most of the complaints even come from enrollees from the National Health Insurance Scheme. You see them they flood a particular section in their numbers, in that, you know, crowd. In their crowd, waiting for approvals.
Yes.
Waiting for approval.
Yes.
So the approval process might even take its own, the bigger chunk of the time before they are attended to. And imagine someone in emergency. So had it been the primary healthcare centers are, you know, upgraded to a certain standard, most of these people that are crowding the general hospitals would, you know, go to these primary healthcare centers. And the doctors will also have this, you know, a comfortable atmosphere to work with. Because if you have a lot of people to attend to, you, as a human being, you'll be famished.
Exactly.
You know, so a lot of consideration. The National Assembly that takes up primary health care project as their constituency project, they need to liaise with the states to find out what are the needs assessments in some of the local governments or in the state, so that if they have a primary health care center, what they need is manpower or what they need is drugs, then these legislators now know where to channel their constituency project, either to build more or to provide the necessary manpower or the drugs. So there must be a deliberate effort. It shouldn't just be like everybody spreading their effort and we are not getting, you know, you are not harnessing it together to achieve the agenda, the health agenda. So if the donor is funding X project, the federal government should move to Y project. So there won't be duplication of effort. And there is a need for proper management, you know, management and enforcement of any of the monitoring mechanisms for any of the project that has been slated for health. Imagine having these drugs heaped up in one particular warehouse, and the state that needs to get these drugs
But isn't
do
that
not
the
have
major
it.
problem that we have? And it's not just related to the health sector, it's to several sectors in Nigeria, the corruption of the human factor.
Yes.
Because it does not make sense. Let's assume government has provided those drugs and said take. We agree that, yes, people are not getting as much funding as they deserve or as they require. But even the ones that they're getting, you have just said it, that there are some warehouses that have drugs that people need. They stay there till they expire. I see that. We know that. But there's a there's a head of that agency. There's someone who knows what is in the store. There's someone who has failed to direct that certain drugs be dispatched to other places. Even in the government hospitals, if you want to jump the queue, you find one nurse and give 500 or give 1,000. They call you to the front. You see the doctor first. So how do we eradicate this human indices that encourages corruption?
Yes.
We're not saying that government is doing all that it should, but even the little that they are doing, we see what's happening. Every medical hospital has a chief medical director,
Yes.
especially government hospitals.
Yeah.
How much are the chief medical, they drive the big cars, they drive the jeeps, they drive, they're living large as a CMD director in government hospitals. How much are they doing? How much are they ensuring that resources that have been given to the hospitals, primary health center, another craziness.
Yes.
You will see people, you said constituency projects, they go there, they build one shackle, maybe put some bandages and plasters and paracetamol, maybe one or two cheap malaria counting drugs, they throw it there, and then they say they've done. You see them call the press, and then they're doing a fanfare of how can we remove that human factor that is also greatly affecting that health sector that we're hoping to see reforms inside.
Yes, you see, the bulk of addressing the inefficiency in the health sector starts and stops with the leadership. Whoever is made the Minister of Health, we expect him or her to be able to bring up initiative and also work with critical stakeholders, on how to enforce the monitoring mechanisms. For instance, there should be a central database that shows what is leaving the federal government's coffers and what is going to which location and who is responsible for receiving or utilizing those items. And also when it is being utilized, there should be a reporting channels, a feedback mechanism to say, okay, XY has been used and this is what is left. So that's comprehensive monitoring and enforcement mechanisms needs to be put in place by the minister who is going to bring up the initiative. Everything boils down to political will. If you have a body language that encourages people to subvert the process or to, cheat on the process, they will definitely go on. But if you show that leadership, everybody will sit up. It can no longer be uhuru. People will know that this person is cut out for the job and is not here to tolerate whatever has been the problem all along. So I think everything starts with the minister. There are lots of stakeholders that could come to the table and also have a think tank discussion on how these things can be handled. No doubt there's corruption in the health sector. A lot of cases where drugs are diverted to personal businesses,
pharmacies, they go there and sell it.
Even private hospitals.
Yes.
And you see the government does not even have a grip of what it is spending and how it is being utilized, And so this is a very big challenge that the minister needs to look into heads on. We shouldn't just leave everything for probably those at the hospital, CMD, because they might not even receive it. Most of this, the logistics, the supply chain of most of the drugs, they might not be aware of it. So, but if the minister makes everyone that should get what they need to get, get aware that so and so commodities are coming to your location and we would want to know how you utilize it, you understand, then there will be a performance and reporting feedback back to the minister. And also, the National Health Act in Section 2 also provide that the state of the health reports should be given on a biannual basis.
Periodic basis, yes.
Yeah, so they should be able to tell Nigerians what is the statistics.
I don't think I've seen
that.
No,
it has not been. It has not been implemented
yet.
And so that is a very big gap that this current, we expect whoever is appointed as the Minister of Health should sit up and ensure that they deliver on that. Then secondly, the health sector is poorly funded. Imagine I and you going to the hospital now and paying out of our pockets. We have about 80% of Nigerians doing that.
Yes.
What if with the high rate of inflation, food inflation is about 25% now. A lot of people are looking for money to eat, not even money to do any other thing.
Yeah.
Yes, and the nominal inflation is about 22.7%. So now, in spite of this economic challenge, you now go to the hospital, you know, where you are battling with your life and you are looking for money to pay. It shouldn't be done. It is time for the minister to also work with the National Health Insurance Authority to implement Section 24 that talked about mandatory health insurance.
But we have the National Health Insurance. Different FCT has this FHSS, Federal Health, FCT Health Insurance Scheme. So we know we have different states. I know Anambra at one time had ASHA, Anambra State Health Insurance. So different states in Nigeria have jumped upon that insurance scheme with a quest to provide. I know for particularly in Anambra, it wasn't just restricted to the civil servants. They took it to the markets because they have more traders. And they said, okay, you know what, pay 1,000 a month, so it's 12,000 a year. And then you saw that community heads, you know, were paying for people in their community. Good initiative, they generated a lot of money. But it's still very frustrating that many people that are using the healthcare services, like you also earlier pointed out, they have to wait to get the code. They have to wait. There are certain drugs they won't give you. And yes, I'm a beneficiary of the FHSS, that's the FCT health scheme, but there are certain drugs they wouldn't give me when I take my kids to the hospital. So I'll tell them, please, don't give me insurance drugs. I will pay. Because they decide the drugs they give to you based on the insurance. So I was like, no. If it's an antibiotic, they'll say, I'll say, no, do you have this? They say, it's not part of, we won't give you that on your insurance. I say, no, I'll pay for it, separate it. And there are quite a number of Nigerians that are deprived that kind of care, that kind of access. You can't see a dentist until you've gotten clearance. You can't see an optician. They can give you glasses not worth more than 2,000. You know, what is wrong? Why are we not getting it right with the health insurance scheme in Nigeria?
Okay, so when we talk about health insurance, the premium you pay determines the kind of service you get. So,
makes sense?
Yeah, so like the 1,000 naira I think people pay are for the basic minimum packages, like treatment of malaria, you know, just those primary healthcare services. But if you want a secondary care, you have to increase the premium.
And I think these don't have that option.
I think they do have. They do have. If you okay, it's a general service package for all federal government service. Yeah, that's what it is.
Yes, but there's the private individuals that can do, you know, there's a private silver or platinum package. I know they have names like that. Yes.
So, but I think there's a need for the government to also review some of the service package to incorporate most of the needs. When we have emerging health needs, there's a need to also review what packages are there, outstanding packages, and you know. But so far so good. The insurance package has really helped a lot of people.
Yes, it has.
It has helped a lot of people. I'm aware of
me especially. It has. So yes.
I'm aware of so many persons that, you know, went through cesarean session, you know, to deliver, and they just paid peanuts for that. If you try that with a private arrangement to pay out of your pocket, you might not recover for the whole year.
I agree with you.
Yes. So there are lots of benefits, but like we keep saying, it's a work in progress. Whatever needs to be reviewed, whatever needs to be put right needs to be done. You know, improvement of the service packages. And I'm also asking that citizens get to know what their insurance package covers for them. There's a service package list that every citizen is entitled to. You don't need to wait for the doctor or the pharmacist to tell you you are not covered for this.
But why do they have to make that phone call every time to get clearance. If I believe I'm on the package and I have maybe my identity card or my number that says I'm there, shouldn't, if you're my provider, primary health provider, shouldn't you have my details to know that, okay, this person, if her number is there, so anytime she comes to punch it in, it's showing she's still paying, it's showing she's active. Why is it that every single test, they must say, wait, let me do authorization. When they get authorization, let me give you the code. I think they generate it. So why? I don't know. Yeah, so explain that.
So those codes are meant to be used for payments. Okay. For instance, if you're going for some specialized service, you know, there is what they call fee for service that needs to be paid on that particular code. Because the capitations are paid from the health management organization, you know, that would pay for that particular service. So they need to have that code. And that code is also what they use in monitoring the quality of care that is given to that patient. If, for instance, somebody went for a full blood count test, you know, and the result comes out and probably the kind of treatment that is given to that diagnosis is wrong, they use the code. The HMO is expected to use the code to treat what's the query, you know, to which that patient was being attended to. So codes are necessary to generate, but it's the time lag to which that is being done. Keeping the patient waiting for long. You know, in cases of emergency, there should be a reform to say, okay, we can go ahead and treat while we generate that code. So that's the idea behind the code. But back to what I'm trying to say about making the health insurance mandatory. You know how these VIOs, they do enforce this paper insurance, your vehicle insurance. Exactly. Why don't we explore that same aggression to make sure that every Nigerian is registered? Because what happens is that the government will generate a lot of funds from people's premium. It's not everybody that will fall sick at the same time. So for those that pay their premium, you know, front-loaded payments or pay on the spot, you know, the idle money can be invested into other areas that will also generate more money back to the health sector. You know, and from a research that was conducted recently, it was reviewed that about 1.17 trillion can be generated annually for the health sector. From the health insurance scheme. And I bet you not everybody would utilize the health insurance services for that year. So the money can be used to invest in upgrading of facilities, recruiting more personnel, you know, in the health sector, while the next fund that will be coming in can also exactly. So this is the kind of ideas we are expecting the incoming administrator, you know, to look into in the space of this paucity of resources. Now, talking about subsidies, a lot of people cannot even afford to go to the hospital. They know they are sick, but they cannot move an inch. Why? Because they understand what it costs to get treatment. Nigerians should be identified. About 133 million Nigerians are poor. The very, very poor people are around 70-something million. This group of people should be captured and let the basic minimum services be provided to them without paying a dime. Because we need to live for us to talk about having people to lead. If these people are not there, you don't have any authority, you know, to enforce any laws on them. So a careful attempt, instead of giving 8,000 naira, the discussion now is about giving 8,000 naira to people, which we know. We don't
even want to hear that conversation. It doesn't make any logical sense as far as I'm concerned, even though I'm not an economist, that you're giving 8,000 naira per household to 12 billion Nigerians. First of all, where's the statistics coming from? How do you determine who's the poorest of the poor? And even in the poorest of the poor, you and I know that with the inflation rate of Nigeria now, 8,000 naira cannot take a family of 2 children, a husband and a wife for a day. Okay. So it's supposed to be for a month.
You are even kind with making extending into a family. An individual, 8,000 might not
take. It is for a household. So what do you
by the time you go to work and come back,
they say it's a household,
and you decide to feed for that day.
So I've used the smallest household. Let's talk about another problem that seems that needs to be tackled in the Nigerian health reform sector. Medical tourism.
Okay.
We've talked about the Japa syndrome, where a lot of young people, 5,000 doctors, have left the country. But we also have our elites who have believed or felt that you know, we don't, we can afford better medical service. So when those needs arises, we leave the country. Our children leave the country. India has had a lot of Nigeria's money in its tourism, medical
Yes.
tourism. Why and what exactly would you expect this administration to be doing to tackle it? I know that there was one time, University of Ibadan, you know, University of Lagos, there were so many hospitals then that you had quite a number of experts coming
Exactly.
in, and you had the top notch there. You had researchers, you had surgeons, you know, but now you're not seeing that. What should Bola Ahmed Tinubu's administration be doing to tackle medical tourism? I know when President Muhammadu Buhari came in, he had said, you know, nobody's traveling, we're putting bans, we're not giving anybody permission, everybody, you're sick. Let us heal the country by healing our reforms, and then what should we do, what should they be doing to tackle that?
So I think first and foremost, the federal government needs to be aggressive in the area of health infrastructure. Because if the infrastructures are not available in the country, people are bound to leave. Somebody will not, you wouldn't know that you have the opportunity of being treated abroad when you have to save, a person needs to save his or her life. And if you have the resources, you won't travel out. You know, so the resources should be, the health infrastructures should be upgraded first and foremost, like we made mention of earlier on. You know, if each zones of the country have maybe like 2 or 3 state-of-the-art facilities that can take care of any kind of secondary health needs you can think of, then those reforms like banning medical tourism can be put in place, because the federal government also have the discretion to say none of its workers should travel abroad for any health needs. They should make use of the facilities. Exactly.
Yeah.
So until those facilities are available in the country with the requisite manpower, you know, then the federal government can now introduce those kind of reforms to ban public officials from traveling abroad. And for private citizens, maybe heavy tax on immigration can be placed on them if you choose to travel abroad when we have those facilities, you know, in Nigeria. So that might also discourage people from, you know, traveling, because when you check the cost of doing that, you know, it will be very high. So those reforms needs to be carefully planned. A think tank with stakeholders on how that can be effected also should be done. So by the time we see the body language of the president and those in authorities, a whole lot of the citizens will queue in. It's a natural cause of effect. People will queue in. They will start appreciating the use of, you know, what we have in Nigeria. And that will also save us the cost of foreign exchange, which is currently scarce now. So we retain our naira value and strengthen it against the currency of the other countries. So I think it's something that is worth doing. And to do that, there is need to collaborate with the private sector, because the private sectors are looking for where to invest. But you must give them...
So do you think that we should actually be exploring that? Because earlier on I said 66% of the government, of hospitals across Nigeria are owned by government. So you're saying that there's a need for the private sector to get
involved. It's a low-hanging fruit for the private sectors to come in.
Okay.
You know, if there's a good incentive for that package, you know, probably tax rebates or removal of VAT on some of their commodities they would like to send into the country, I think they would buy that idea. You know, they want to invest in it. So we just need initiative. Even the state governments, it's not just for the federal government, the subnational, you know, health is on the concurrent list. So the federal government cannot satisfy all the health requirements in the whole 36 states.
Absolutely.
So the state governors need to also be thinking along that line, you know, creating incentive for the private sector, you know, to invest in state-of-the-art facilities, and also keeping, one thing is to have these facilities, but another thing is to maintain
it, and we don't really have that
We
culture.
don't have the culture of maintenance, you understand? So paying the doctors properly, you know, research is another area that Nigeria needs to explore. Nigerians are very good. When you go to other countries, we are sought out. Our medical doctors are sought out. They go there and they explore, they do their research, and, you know, most of this country leverage on the outcome of their products. But in Nigeria, what we do is just to allocate money to research institutes, and nothing is coming out. There's no products coming out from these institutes. So what we are looking over there, we have them here. we have them here. It's just for the federal government to demonstrate that political will to bring everybody together to say, okay, come, we must get things right this time around, you know. And so when you set up these facilities and you get the right people to man them, and, you know, we keep on evolving in our research and causal treatments for most of the ailments that we face in Nigeria, I think nobody will want to travel abroad. They will even be coming here. They will be coming down here.
Well, let's hope that
yes,
comes
it is.
true,
It is
because
possible.
that's what we're praying.
So you ask, why are they looking for Nigerians?
Because
Nigerians
we do have very good doctors.
Exactly.
Yes.
So we
that
have
hasn't
it
been
here.
the problem.
We
Our
have
medical curriculum is very effective.
Yes.
We have the advantage of very good doctors. So
yes.
maybe when they go there, then faced with
and
easier
very hardworking doctors that are ready to. Some of them even complain that over there they work close to 24
hours. It's a new administration. Let's keep our hope and let's keep our hope renewed.
Yes, we can only be optimistic
that something would give, and then we have to
Exactly.
get the kind of health sector
Yes.
that Nigerians truly deserve,
Yeah.
which is a very good one. But we want to say thank you so much, Victor Ezenwa
Emejuiwe.
Emejuiwe. Thank you so much
All
for
right.
being our guest. Victor is the Program Manager at Good Governance Center for Social Justice. Thanks once more for being on ASO
It's
Morning.
my pleasure. It's my
Great.
pleasure.